Hello ladies and gentlemen, and welcome to today's video podcast from Vetstoria. My name is Morko Pienaar, and today we will be discussing the topic of cataracts in our pets. At the end of this podcast, we aim to answer the following 4 questions. What are cataracts? What do they look like? What causes cataracts? And how can we treat them? Here is a model of a dog's eye. If we look inside the eye, we can see the lens, which is a transparent structure in the middle of the eye. Well, a cataract is any opacity that occurs in the lens of the eye. It may be involving part or the whole of the lens. The lens is normally completely transparent. This is quite an amazing thing if you consider that the lens of the eye consists of living tissue. The cells that make up the lens are organized in a very specific manner to allow light to pass through the lens. When these cells stop being transparent, we refer to it as a cataract. Cataracts usually have a whitish appearance when viewed in normal light. This is because the light is reflected back rather than passing through the lens. To answer this question, the best way is to show you a few pictures of cataracts. We will first look at the picture of a normal eye of a dog, unaffected by cataracts. Notice how the pupil appears dark and the lens is completely transparent. The next picture is of an immature cataract. Although the lens is still mostly transparent and we can see light reflected back at us from the back of the eye, the immature cataract is clearly visible as an opacity extending from the center of the lens to our right-hand side. The following image is that of a relatively small, bright white cataract located centrally in the lens, with the surrounding area of darker, transparent lens visible. The final picture is that of mature cataracts affecting both eyes of this dog. As you can see, both lenses appear completely white and the pupils are widely dilated. Now that we know what a cataract looks like, let's talk briefly about what causes it. There are many different causes for cataracts. Some are genetically inherited and some develop due to old age. Others may be caused by diseases or infections inside the eye, and some metabolic diseases like diabetes may also cause cataracts. There are also some other less common causes for cataracts that are beyond the scope of this podcast. Regardless of what the specific cause is, the end result is always the same. The structure of the cells in the lens is changed and they become opaque rather than transparent. Some cataracts take a long time to develop, while others, like those caused by diabetes, can develop overnight. This is a picture of one of my patients affected with diabetes. I can tell you that this mature cataract developed within 48 hours. As in humans, cataracts in animals can be surgically removed. Be aware, though, that this is not as straightforward in animals as it is in people, and complications are more common. Not all animals with cataracts are suitable for surgery. There are many reasons for this, and it is very important that your pet is assessed by a veterinary ophthalmologist to determine if cataract removal is suitable for your pet or not. Either way, they will be able to advise you on the best treatment options for your pet. Also remember that it is very important to determine what causes the cataract in the first place. It is therefore important to take your pet to your vet to be examined if you notice any changes in the eyes. Your vet will then decide whether any treatment is necessary at all for either the cataract or its underlying cause. Well, that concludes this video podcast. Thank you for listening. And remember to check out vetstoria.com for further video podcasts, and feel free to leave any comments or suggestions for future topics. Goodbye.